Hi everyone, I'm Dr. Daamini and I am making this video diary to document and record a journey that I'm about to embark on today, one that I think could be quite helpful as a handbook to other women in my situation. So what I'm about to start today is the process of freezing my eggs, and being a medical doctor, I'll be able to give you some unique insight as well, and I'll try and keep it as raw and unfiltered as possible. It's 14th of December 2023. I am here for my first scan. They're going to have a look at my ovaries and uterus, just make sure everything is a-okay, and then I can start my injections hopefully next week. I hope this will be helpful to whoever is interested. For whatever reasons that you may have decided to delay having children, this is quite a useful tool and piece of technology that we have. So I do advise anyone who's thinking about it to watch this and then hopefully make an informed decision about it. I'm doing it at Conceive Gynecology and Fertility Hospital. Dr. Pankaj, who is the medical director, is one of the oldest doctors in this region in the field. He actually started the first IVF unit in UAE, so very, very trusted, very reputable. And yeah, I'll take you on this with me, so come along. Okay, so I'm having blood drawn just to check my AMH. It's a hormone that tells you how many eggs you have left. Okay guys, so my blood results came back, and then based on that I've been prescribed a pen injection and some tablets to stimulate my ovaries. So I am going to start taking these on the second day of my period. Okay, so I will then show you how we draw up the injections, how we, fit the needles on the pen and the dosing and everything. The tablets are obviously very simple. I've got to take 2 of these every day for whatever the dose is prescribed. So, but I just wanted to come on here and point out that not everybody is going to get the same dose because it varies based on your blood results, okay? But this is what I've been given, and of course, these are spirit swabs to clean the skin before I inject. So I just wanted to share a quick update. Today is the 18th of December 2023, and it's the first day of my period. So tomorrow is when I'll start the injections as well as the tablets, and then I'll film that, I'll document that, and then on the 6th day of my period, so that would be the 23rd of December, which is a Saturday, is when I have another scan. So it's happening. So it's day 2 of my period. Today's the 19th of December, and it's also the first day of my hormonal injection. So I'm going to take you through the whole thing, how to set up the pen, how to right to injecting, and then the next couple of days it's pretty much the same, so I'll fast forward through them. I'll still film them and I'll still document them, but today's going to be the slow step by step. All right, so because the pen is pretty much, I think, what most people get. So you're given a pen, and then you're given these needle tops for daily use, and you're given spirit swabs to clean. I've also just taken 2 tablets that I was prescribed as well, and I've got to take 2 of those every day when I take these injections. So all right, first things first, remove the cap of the pen. You are supposed to wind up the dose using this thing to whatever's prescribed by your doctor. So in my case, I'm meant to take 300 units of this dose. So it'll say 300 on the window there. I don't know if you can see that, but there we go. Right, okay. Then we got to load the needle, or prep the needle. So you tear off that cover like that. You'll see there's a back point to the needle in there. Okay, and then we screw that on to the pen just like that. Secure it. Yeah, I think that's secure. Okay, you then lift off that plastic cap, pop that away. Right, okay, sorry, just gotta prep myself a little bit. I'm trained to do this for other people, so it is a little bit unerring to have to do it for myself, but I'm committed. So right, spirit swab, you want to clean a little bit, not a little bit, you want to clean it quite thoroughly, because the last thing you want to do is induce skin infections in there. So give it a nice thorough clean, disinfect that area, toss that away. Now, before I take this cap off and inject, the trick is to have the numbers facing you as you're injecting, so you can see the dose as it's being administered, and the ticker will go down, okay? So, all right, here we go. That's out. Right. Ready? Oh my gosh, this is a little bit weird to do this. Okay, ready? Here we go. Yeah, oops. The dose is going down. I can see it winding down. Here we go, here we go, here we go, here we go, all the way, all the way. And that's 0. Oops. And you can just wipe away if there's a teeny bit of blood. All right, that's day 1 done. To dispose of the needle, you put this plastic cap back on, the big one. You unscrew it. Then there's a part of the needle that's exposed behind, so you put the green cap on there just to cover it from a safety point of view, and then you will dispose of that later, okay? So, okay, that's day 1. Same thing tomorrow. What I will do is inject on different sides. I was warned that you might feel a little bit of site soreness, so I will make sure that I'll do it on my left side tomorrow. So, and I'll update you if there's any changes to my mood or if I feel any different, but hopefully it should be all right. Okay, second day of hormone injections, day 3 of period for menstrual cycle. I've already prepped the pen like I did yesterday, so we're all ready to go. I'm actually, I was thinking about this and I wanted to just address it. I'm purposefully not mentioning the name of the drug that I've been prescribed, because it does vary from patient to patient. So I don't want it to be where somebody thinks that they'll get the same drug as me, because remember, everybody's body is different, everybody's doses are different, and so depending on what your doctor has prescribed you, it will vary, and it will also determine the response that you get to it. All right, so that's why. And remember, the whole point of this is normally we produce 1 egg a month per menstrual cycle. The aim of this is to encourage your body to produce as many as possible so that they can be collected and then frozen. Okay, so all right, the next couple of days is going to be relatively quick, but day 2 of injections done.
Oh, woman, hey, Dapper Dan, you both got your style, but brother, you're never full.
Morning. So I wanted to check back and just give an update of how things have been going. Today is the 6th day of my menstrual cycle. I have just taken my 5th injection this morning, and today, it's the 23rd of December, I am going to go and have a scan, and this is a progress scan, so they want to check how your eggs are responding, and then based on that they'll decide when to schedule the actual egg collection. So say it's I'm just making this up hypothetically, I don't know, but say it's on Wednesday or Thursday next week, 3-4 days from now, then depending on that, your trigger shot has to come in. I think it's 36 hours before the actual egg collection. You get a different dose of hormones, different needles also, I hear. So I just wanted to give a progress update. I think in a way I was almost expecting to feel differently, for my body to respond in a maybe not so pleasant way, but honestly I've felt nothing. It's been very easy. I have not felt inflamed. I've continued working out and eating healthy like I usually do. So yeah, I can't report anything, to be honest. No side effects so far. I've been sleeping well. I mean, of course, at the injection point, you get a little bit of a soreness, but honestly, it's not even something you'd notice. Now, that being said, I also want to add, it is different for different women, depending on your body weight, your genetics, your age. So many factors come into play. I know some women report feeling very inflamed, quite bloated. I've had none of that. I think if I have to give credit to one factor, I think it's being physically fit. I work out 6 times a week. I have been for a long time. I'm quite athletic, and I eat really well. I sort of steer clear from junk food and that sort of thing. I do eat chocolate every day though. But yeah, I think it's been, so far it's been very easy. So yeah, I've got nothing to report. But like I said, don't let this be the benchmark. It can vary from woman to woman. Anyway, I'm gonna go get ready and go for my scan now, and after that I'll give you another report. See you soon. So I've just finished my scan. This was to see if the eggs are growing nicely, and they are, so that's quite a relief. I wasn't aware that I was so nervous. It's Saturday the 23rd of December. I have to come back in 3 days time, so that will be day 9 of my cycle, just to see. That will determine when the eggs can be collected. Hormone injections continue as they have been. I've been given an extra tablet as well to hold the eggs so that they don't rupture. And yeah, so far it's looking okay. I am purposely not mentioning the number of eggs and that sort of thing. One, because it's private and personal to me, and 2, because I want to be mindful and sensitive. Every woman will have a different reaction, a different number of eggs, and it depends on so many factors. So just want to be really sensitive to anyone else going on this journey. But yeah, onwards and forwards at the moment. I'll keep you posted as I have been.
You both got your style, but brother, you're never fully.
Morning. I wanted to come on and give a small update on how I'm feeling. Today is the 26th of December, so Boxing Day. It's day 9 of my menstrual cycle and the 8th day of my injections, and today is the first day that I can report feeling slightly uncomfortable, and I mean ever so slightly. It's mild discomfort that I'm feeling in my lower back region, just above my pelvis. What I feel is heavy, and I think if I think about what's happening, remember, we're supposed to produce only 1 egg in an ovary at a time. Here I've got a whole bunch of hormones that are stimulating both my ovaries to produce as many eggs as they possibly can. I feel like I'm carrying 2 heavy baskets of eggs, one in each ovary on either side of my lower back. And so I think that's what I'm feeling. So much so that I was actually meant to do quite a heavy workout today, quite intense, HIIT and cardio and lifting heavy and all of that. And I couldn't, the idea I felt like my body needed something more therapeutic and rehabilitatory. So I've actually done a lot of Pilates today, and I feel better now, not as heavy, not as compressed. But yeah, so I think it's really important to pay attention to what's happening to you. I also feel a definite drop in my appetite. Like I'm not very hungry, and I'm usually quite a hungry person. Like I want to be fed all the time. So I'm eating obviously what I need to in terms of making sure that I get all my nutritional requirements. But yeah, first day that I'm not feeling quite myself, and I think that's the only way I can put it. It's nothing that is stopping me from going about my day. It's a working day for me today, so I've basically gone about my usual routine, but there is something that I can't ignore in the form of that discomfort and heaviness. I also realized just by looking at some of my progress videos, I do have a mild degree of bloating. It's very mild, and like I said, because I've been quite particular about my diet and obviously continued working out the way I have, it's not tremendous. So again, can't emphasize how important it is to be fit and healthy in this process. And lastly, I am due to have a scan again, my 9th day of menstrual cycle scan today, and today is the day that they'll be able to tell me when we can potentially collect the eggs. So I'll keep you posted on that. I've just come out of my scan, day 9 scan, and it's good news. The eggs are growing nicely. They're almost ready to be collected, so yay! I've already done my hormone injections for today, as you saw in the morning. Tomorrow, which would be day 10 of my cycle, and I just need to take a tablet that I've been prescribed, and in the evening I need to take the trigger shot, which of course you will see, and then Thursday, 28th of December, don't have anything to do, so yay, that's a relief. And then finally, Friday morning, 29 December, my eggs are going to be collected. So almost there, home stretch, and yeah, come along. So today is day 10 of my cycle. It's the 27th of December. It's Wednesday, if anyone cares. Today has been a little bit different. So in the morning, I took the tablet that I was prescribed as usual. I didn't take the pen injections because now I am about to take these different needles, different drug. These are the trigger shot injections. And not gonna lie, a little bit nervous about these because these needles are a little bit bigger. So I do advise, if you're someone that's needle phobic, to maybe enlist the help of someone else to do it. Of course, I'm going to do this myself. So what this does is it basically triggers the eggs to be released from their sacs. And then 36 hours after I take these, which will be Friday morning, is when I will have the eggs collected. So once they're out of the sac, then they can be collected by the doctor. So yeah, I just wanted to, I'm going to obviously, you know, film this and take you through it. Just wanted to also have a quick update about how I'm feeling. Definitely still feeling that heaviness. Obviously, so normally a woman feels heavy when her body's producing the one egg during a normal menstrual cycle. Here, of course, I've been stimulated a lot to produce more than just the one egg. So, like I said, feeling like I've got 2 egg baskets full. So that's a good thing in a way, but it is definitely uncomfortable. How that it's affected me is, look, it hasn't changed anything in terms of my daily life. I'm still going to work. I'm still training. What I have changed is I have taken down the intensity of my workouts just because my body doesn't feel like it. I've actually done a lot more deep stretching, slower workouts. Intensity has been on the lower side. Lots of steady state cardio. I find that keeping moving definitely reduces the amount of discomfort you're feeling. So again, one piece of advice I would give to anybody that's doing this is, please don't be a couch potato. Don't sit on your backside because you genuinely feel worse. Get up, stretch, move around. Can't recommend that enough. I will also say that I have noticed a drop in my appetite, and I think that could be attributed to the hormones. I'm still eating what I need to eat in terms of getting in all my nutrition, but yeah, just that's something that I feel like I'm having to force myself to eat as opposed to normally I feel quite hungry a lot. So yeah, that's pretty much it. Trigger shots now. Tomorrow, which is day 11 of my cycle, I have nothing, so I probably won't even film anything because there is nothing to film. I don't need to take any tablet. I don't need to take any injections. It's straight now to Friday morning where you'll see me in hospital getting ready and prepped to be wheeled into the theatre to have my eggs collected. So yeah, after these trigger shots, a day off for me, much needed. So the first thing I'm going to do with these needles is I'm going to prep them. And what I mean by that is you want to remove the cap, you get the needle, and what you want to do is first just tap it so that you make sure all the air bubbles are released. You definitely do not want to be injecting air bubbles into yourself. So give it a little bit of a tap. And then what you want to do is you want to push the drug out. The plunger is a little bit tight, but you want to push until you actually see a drop of the drug coming out, and that's when you're ready to inject. So then you put the cap back on, put it away. I'll prep the other needle as well, and then you will clean the area. So again, tap, 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 tap. Oh, this one has a few more air bubbles. So tap it away, tap it away, tap it away. And then let's push this plunger out and just making sure, yep, there we go. Fluid Cap on. All right, now I will say one more thing. I am definitely feeling some of the soreness from all the multiple injections so far. It's very mild on a scale of 1 to 10, 10 being the highest. It's only a 1 or a 2, but it's there. It's something that you'll notice. You can't ignore it, okay? All right, here we go. Final injections, but of course the most deadly ones of them all. Right, so I'm going to do one on each side as I was advised to. The trick is to push the entire needle in and then slowly put all the fluid into the subcutaneous region, and then clean the other side and do the same. I am going to, the reason I'm telling you all this before is I don't know if I'm going to be able to speak to you whilst I inject, okay? Because it is a little bit nerve-wracking. But here we go, 90 degrees. Pull it out. That's one done. Ow. It definitely stings a little bit more than the others, I'm not gonna lie. Like this time you know there's a needle. I can't describe it any other way. Also because I'm seeing it. But, well, it's gotta be done. And on the plus side, last one. Here we go. You can see I've put my hair up as well because I knew I needed all my concentration and just couldn't be distracted in any way doing this. All right, last injection. Here we go. Ow. All righty. All done. Ow. I can't explain it, but there's almost like a tingling, sharp pain that you get. Again, mild. It's not like I'm talking to you, so obviously not that I can't manage it, but ow. Oh, you can feel it. You definitely feel that you've been poked. So yeah, we are done with injections. So now the next thing you'll see is me in hospital, and yeah, 36 hours from now. So keep watching.
So senator, so janitor, so long for a while. Remember, you're never fully dressed without a smile.
Good morning. I'm done. Egg collection done, and I'm so pleased. Really pleased with the results. Really pleased that I got through this. The whole thing was so smooth and breezy. So if anyone is considering doing it, I can't recommend it enough. Do it. And now that you've seen what it entails and involves, it shouldn't be as daunting or nerve-wracking. You come in the morning, the anaesthetist will talk to you, ask you a couple of questions in terms of allergies and, you know, that sort of thing, and then you're prepped to go into OT. It's not done under general anesthetic. I think it can be offered for some people, but for me, you know, I chose not to, and mostly it's not done under that, to be fair. How the drug affects women varies greatly. I was awake through the whole thing. I didn't feel any heavy sort of drowsiness. You feel a little heavy in your head, but that's just about it. I saw my eggs being collected and everything, so it was really, it's really a nice thing. It's a very unique bonding experience you get to have with your body, and yeah. And then after the procedure, you're kept for an hour or two. Just, you know, the nurses will want to monitor you before discharging you. They'll make sure you get a drink of water, you pass some urine, you know, and then they give you the all clear. You cannot drive home, all right? So I'm being driven home right now. Make sure you've got somebody to do that for you. And yeah, am I in any discomfort? None whatsoever. So ladies, this is what it takes to have your eggs frozen. Thank you so much for watching, for having been with me on this. I hope I inspire just even one lady to go and get her eggs frozen. You definitely feel a sense of security and safety in a way. And like I said, it's almost a good thing in a way to get in touch with your body like this and see it up front and up close and so intimately. But yeah, that's a wrap.